Good morning. Today we're going to explore one of the most critical and increasingly relevant topics in nursing practice, the health impacts of disasters. As future nurses or current nurses, you will be practicing in a world where disasters, both climate related and human made, are becoming more frequent and severe. This presentation will prepare you to understand, assess, and respond to complex health needs that arise from these events. We'll be looking at physical health impacts, mental health consequences, how healthcare systems are disrupted, and the long term health effects that can persist for years or even decades after a disaster occurs. By the end of today's session, you should be able to accomplish 5 key learning objectives. First, you'll be able to identify the various physical health impacts that result from different types of disasters, from heat related illness to radiation exposure. Second, you'll recognize the mental health consequences that affect both individuals and entire communities. Third, you'll understand how disasters disrupt healthcare systems and challenges and the challenges this creates for providing care. Fourth, you'll be able to describe the long term health effects that can persist long after the immediate disaster has passed. And finally, you'll understand how to apply the nursing role across all phases of the disaster cycle, not just during the emergency response, but also in preparedness, recovery, and mitigation. These competencies are essential for 21st century nursing practice. So, not everything that you learn in school is going to be how it is when you're out in the field doing a disaster response. We can't teach you everything. I used to joke that one of my undergraduate nursing professors, Dale Goodfellow, taught us these antiquated things, and why did we need to know that? And it wasn't until I was out in practice and hanging chest x-rays to dry on a lemon tree in Guatemala that I sent her this picture and said, "You didn't teach us this." And she used it until she retired to explain to students why some of the things you learn in class you may not think you need to know, but you never know what you need to know. This was just to point out that not all disasters are related to climate. This was ships that brought over 500 Chinese refugees that were seeking asylum in the U.S. The ship was sinking, so it got pulled to port in Guatemala, and we went down there to provide care and screening. Let's start with a foundational understanding of what we mean by disaster. A disaster is defined as a serious disruption of the functioning of a community or society that causes widespread human, material, economic, and environmental losses that exceed the affected community's ability to cope using their own resources. This is a key point. It's not just about the event itself, but it's about whether the community can handle it with existing resources. Disasters come in many forms. Climate-related disasters or disasters of extreme weather include wildfire, floods, extreme heat events, droughts, and severe storms. And we're seeing these with increasing frequency and intensity. Nuclear radiological disasters involve radiation exposure and contamination events. Natural disasters include earthquakes, hurricanes, and tornadoes, and human-made disasters include industrial accidents and infrastructure failures. Here's the critical point I want you to remember. All disasters have significant health consequences that extend far beyond the immediate event. We're not just talking about injuries during the disaster itself. We're talking about health impacts that can last for years, decades, or even generations. To effectively respond to disasters, we need to understand that disasters occur in cycles with four distinct phases. The phases we've covered in previous lectures, but they include uh, preparedness. This includes planning, training, resource allocation, and community education. This is where we prepare before anything happens. The second phase is response. These are the immediate actions taken during and after the event, including emergency care and triage. Third phase is recovery. This involves restoration of services, rebuilding infrastructure, providing long-term care, and addressing mental health needs. This phase can last months to years. The fourth phase is mitigation. These are actions taken to reduce risk of future disasters, including policy changes and infrastructure improvements. Here's what I really want to emphasize. Nurses are essential in all of these phases. Too often, we think of disaster nursing as only emergency response, but nurses play critical roles in preparing communities, supporting long-term recovery, and advocating for policies that reduce future risk. As you develop your nursing practice, think about how you can contribute to all four phases. Let me give you some concrete data about what's happening right here in New Mexico. Between 1980 and 2024, New Mexico experienced $38 billion disasters over a 45 years. The historical average was 0.8 disasters per year. But look at what's happened recently. Between 2000 and 2024, the average jumped to 2.2 disasters per year. That's nearly 3 times the historical rate. This is not a coincidence. This is climate change in action. The primary climate-related threats we face in New Mexico include wildfires, and forestry officials now warn us of a potential year-round wildfire season, which is unprecedented. We're also seeing extreme heat and drought, flash floods, and severe storms, including dust storms. Notably, disaster years include 2005 with 116 disasters, and 2011 with 122 disasters. In 2022, we experienced the Cap Canyon and Hermit Peaks fires, which became the largest fires in state history. This is the context in which you'll be practicing nursing, a world where disasters are becoming the new normal. Wildfires are not considered the disasters that are most closely linked to climate change, but they are exacerbated by drought and can be followed by flooding in burn scar areas where there's no vegetation to absorb rainwater. The costly disasters most closely linked to climate change in the U.S. are tropical storms, cyclones, droughts, severe storms, and inland flooding. However, the increasing incidence of extended drought has resulted in an increasing risk of extended wildfires, especially in the western U.S. From the 2008 Camp Fire in Paradise, California, to the Maui wildfire in 2023, the incidence of wildfires has decreased while the number of acres burned has increased in the last 30 years. The U.S. Environmental Protection Agency, based on data from the National Interagency Fire Center, found that the largest areas burned have occurred since 2004, coinciding with the warmest years on record. Increased temperatures and vapor pressure deficit from 2000 to 2015 contributed to forest areas experiencing an average of 9 more days of burn. New Mexico is at particular risk for wildfires due to global-scale climate warming, drought, shorter winters, hotter summers, forest changes from invasive species, plant types, conversions, land use decisions, and anthropogenic climate change impacts on the ecosystem recovery. Let's dive into specific physical impacts, starting with extreme heat. This is actually the leading weather related cause of death in the United States, more deadly than hurricanes, floods, or tornadoes. Just in New Mexico, between April and July 2024 alone, there were 505 heat related emergency department visits. That's just what we captured in the ED. Many more people suffered at home. The physiological consequences of extreme heat are serious. Heat exhaustion involves dehydration, electrolyte imbalance, weakness, and nausea. If untreated, this can progress to heat stroke, where the core body temperature exceeds 104 degrees Fahrenheit, leading to altered mental status and potential organ failure. This is a medical emergency. Heat also causes cardiovascular strain. The heat has to work overtime to cool the body, which can trigger cardiac events, especially in people with existing heart disease. We also see exacerbation of chronic diseases with stress on the kidneys, heart, and respiratory system. And here's something many people don't realize. Sleep disruption from hot nights prevent the body from recovering from daytime heat stress. This brings us to the extreme nighttime heat, which is one of the most dangerous and overlooked consequences of climate change. Nights are actually warming faster than days in many regions. When the body can't cool down at night, it creates cumulative physiologic stress that compounds over days and weeks. Now, let's talk about wildfire smoke, which has become an increasingly serious health threat. The 2002 Cass Canyon Hermits Peak wildfire burned over 340,000 acres and destroyed more than 1,000 structures. But the health impacts extended far beyond the burned area. Poor air quality persisted for weeks across the region. The health consequences of wildfire smoke are extensive. We see respiratory distress, an exacerbation of asthma and COPD. People who normally manage their respiratory conditions well suddenly find themselves in crisis. Hospital visits increase for chest pain, and we see cardiovascular events, including heart attacks and strokes. The particulate matter in smoke is so fine that it enters the bloodstream and affects the cardiovascular system. People also experience eye and throat irritation, headaches, and fatigue. The long-term effects are equally concerning. Chronic respiratory conditions can develop. There's an increased cancer risk from cardiogenic compounds in smoke, and vulnerable populations can experience permanent lung damage. Here's a critical point for patient education. Wildfire smoke is not just an outdoor issue. Indoor air quality is compromised even with closed windows. People need to use air filtration, create clean air rooms, and limit indoor activities that stir up particulates, like vacuuming. New Mexico has a unique and troubling history with nuclear disasters that continue to affect health today. Let me walk you through the major events. The Trinity test in 1945 was the first nuclear bomb detonation. Radioactive fallout spread over unprotected populations who had no idea what was happening. These people are known as downwinders. Between 1945 and 1946, there were critical accidents at Los Alamos where scientists died from acute radiation syndrome. But the event I want to focus on is the Church Rock uranium mine spill in 1979. This was the largest release of radioactive material in U.S. history. Yes, the larger than 3 Mile Island, which happened just 4 months earlier. 1,100 tons of uranium waste and 94 million gallons of acidic radioactive water were released into the Puelco River. The contamination traveled 80 miles downstream. And the legacy continues. There are over 500 abandoned uranium mines in New Mexico, particularly on the Navajo Nation, that continue to present environmental and health risks from radiation. There are no historical events. These are not historical events. They are ongoing health crises affecting communities even today. Now, let's talk about what radiation actually does to the human body. With acute high-dose exposure, we see acute radiation syndrome, which includes nausea, vomiting, diarrhea, bone marrow suppression, and potentially organ failure and death. This is what happened to the scientist in the Los Alamos accident. But most of the health impacts we're dealing with in New Mexico involve chronic health effects from low-dose, long-term exposure. This includes increased cancer risk, particularly lung, bone, and kidney cancer. We see kidney disease and renal failure, cardiovascular disease, immune system dysfunction, and reproductive health issues. Uranium has specific toxicity patterns. As a heavy metal, it's chemically toxic to the kidneys. Its radioactive decay products, particularly radon gas, cause lung cancer. And uranium accumulates in bone, leading to bone cancer. As nurses, when you're taking health histories from patients who live near former mining areas or contaminated sites, you need to ask about environmental exposure. This is part of a comprehensive nursing assessment. The environmental contamination from these nuclear disasters creates long-term health risks that persist for decades. Water contamination is a major issue. We have groundwater seepage into shallow aquifers, contaminated drinking water sources, and irrigation water that's unsafe for crops. Livestock water is also contaminated, which affects the food chain. Soil and sediment toxicity is another problem. Radioactive waste settled along river banks, creating hazardous contamination in river valleys. Agricultural land has been rendered unusable in some areas. The impact on communities, particularly Navajo communities, has been devastating. The Navajo people use the Puerco River for drinking water, irrigation, and livestock. After the Church Rock spill, they were not warned for days after the toxic dangers. Livestock died, and remember, livestock are essential to the economy and culture of these communities. Here's the sobering reality. As of 2017, this is 38 years after the spill, the Church Rock area continues to show the effects of the 1979 spill. This is what we mean by long-term health impacts. These are not problems that go away quickly. Now I want to talk about a critical concept, health equity. Not everyone is equally vulnerable to disasters. Certain populations are at much higher risk. Elderly adults have reduced ability to regulate body temperature and often have chronic conditions that are exacerbated by disaster. Infants and children have developing systems and high metabolic rates that make them more vulnerable. Individuals with chronic conditions like cardiovascular disease, diabetes, and respiratory illness are at higher risk. Outdoor workers in agriculture and construction have greater exposure to heat and environmental hazards. Low-income communities often have limited resources to prepare for, recover from disasters, and residents of manufactured housing often have poor insulation and no air conditioning. Urban residents with limited green space experience the heat island effect more severely, and indigenous communities living near contaminated sites face ongoing exposure to environmental toxins. Here's the key point I want you to understand. Health burdens are not distributed equally. Socioeconomic factors and historical injustices amplify vulnerability. As nurses, we have a responsibility to recognize these inequalities, advocate for the most vulnerable populations. Environmental justice is a nursing issue. While we've been focusing on physical health, we cannot overlook the mental health consequences of disaster, which can be just as serious and often more long-lasting. In the immediate aftermath of a disaster, we see acute stress reactions, anxiety and fear, grief and loss, and disorientation and confusion. These are normal responses to abnormal situations. But the long-term mental health effects are where we see the most significant impact. Post-traumatic stress disorder, or PTSD, is common after disasters. We also see depression and prolonged grief, anxiety disorders, substance use disorders as people try to cope, and sleep disorders that can persist for years. There are also heat-specific mental health impacts that many people don't realize. Heat stress is linked to increased irritability and aggression. Crime rates actually increase with temperature. We also see cognitive impairment during extreme heat, which affects decision-making and functioning. At the community level, we see community-level trauma, loss of sense of place and community identity, cultural trauma, especially in indigenous communities where sacred sites may be destroyed, and intergenerational trauma from environmental disasters that affect multiple generations. As nurses, we need to screen for mental health impacts and connect people with appropriate resources. Mental health is not separate from physical health. They're interconnected. One of the most challenging aspects of disasters is disruption of health systems themselves. Think about it. Just when people need health care the most, the system is least able to provide it. Let me walk you through the challenges. Facility damage is a major issue. Hospitals and clinics can be destroyed or made inaccessible by flooding, fire, or structural damage. Power outages mean loss of electricity for medical equipment and refrigeration for medications like insulin. Supply chain disruptions lead to medication shortages and depletion of medical supplies. And staff shortages occur when healthcare workers are themselves displaced, injured, or unable to reach facilities due to road closures or lack of transportation. Not to mention the fact that healthcare workers also have families. Communication breakdown means loss of electronic health records and challenges coordinating care. And then we have surge capacity issues. An overwhelming number of patients arriving at once. Limited ICU beds and ventilators, difficult triage decisions about who gets care first, and the need to evacuate existing patients to make room for disaster victims. Here's an important point. Hospitals and clinics change rapidly during disasters. By the time data is mapped showing which facilities are operational, the situation may be already changed. This is why communication and coordination is so essential. Let's talk about a specific challenge, maintaining continuity of care for patients with chronic conditions during disasters. Think about diabetes management. People need insulin, which requires refrigeration. They need to monitor blood glucose, which requires supplies and functioning equipment. During a disaster, these things may not be available. Cardiovascular disease patients need access to their medications, and the stress of the disaster itself can exacerbate their conditions. People with respiratory conditions need their inhalers and oxygen supply. Those with mental health conditions may have their medications interrupted and lose access to therapy. Dialysis patients face particular challenges. They need to access facilities on a strict schedule, and if the dialysis center is closed, they're in immediate danger. Medication access becomes a huge issue. Pharmacies close, prescriptions are lost during evacuation, insurance and documentation challenges arise, and medications spoil without refrigeration. As nurses, anticipatory guidance for patients with chronic conditions is essential. In your community health rotation and in practice, you should be teaching patients to have emergency supplies and medications, to keep a list of their medications and dosages, and to have a plan for how to access care if their usual provider is unavailable, and to wear medic alert identification. I want to emphasize that disaster health impacts don't end when the immediate emergency is over. The timeline of health recovery is extended, often years to decades. For physical health recovery, chronic respiratory conditions from smoke exposure can last for years or decades. Cancer from radiation exposure has a latency period of 10 to 30 plus years. People exposed as children may not develop cancer until they're adults. We see cardiovascular disease progression and kidney disease from toxic exposure. Ongoing treatment for disaster-related injuries continues long after the disaster has ended. And mental health recovery also follows an extended timeline. PTSD symptoms may not emerge until months after the event. Depression can persist for years. People experience anniversary reactions and triggers. The date of the disaster, similar weather conditions, or news coverage of other disasters can all trigger symptoms. Community health recovery involves rebuilding healthcare infrastructure, which takes years. There is a need to restore trust in public health systems, especially if communities feel they were failed during disaster. We have to address health disparities that often widen post-disaster because vulnerable populations have fewer resources for recovery, and environmental remediation for contamination sites can take decades. When we talk about disaster nursing, we're not just talking about the dramatic emergency response. We're talking about sustained, long-term commitment to affected communities. Let's look at a specific case study that illustrates these long-term impacts. The Church Rock uranium mine spill. On July 16, 1997, a United Nuclear Corporation, basically Tellings Pond, breached its dam. The immediate impact was catastrophic. 1,100 tons of solid radioactive waste and 94 million gallons of acidic radioactive water were released into the river. The contamination traveled 80 miles downstream. And here's the unconscionable part. Navajo communities were not warned for days about the toxic dangers. They continued using the water and for drinking, irrigation, and livestock. Now, 45 years plus later, we're still seeing the long-term health consequences. There are increased cancer rates in exposed populations, high prevalence of kidney disease, reproductive health issues, and intergenerational health effects. Children and grandchildren of those exposed are experiencing health problems. The environmental contamination is ongoing. What are the lessons for nursing from this case? Well, let's walk through them. First, environmental health histories are critical. When you're assessing a patient, ask about where they live, what environmental exposures they may have had, and whether they live near any contaminated sites. Now, many people won't know the answers to these things, but you can Google that. Second, health impacts can span generations. This is not just about the individual patient in front of you. Third, community engagement and trust building are essential, especially when communities have been failed by institutions in the past. And fourth, advocacy for affected populations is a nursing responsibility. The American Nursing Association Code of Ethics requires us to advocate for vulnerable populations. I just wanted to include for you a picture so that you have an idea of the location where this occurred, and a link in the video, but you can also look that up online that shows you the map so that you know where it is in New Mexico. As nurses, you need to understand that injury and illness patterns vary depending on the phase of the disaster. In the immediate phase, which is 0 to 72 hours, we see traumatic injuries like burns, fractures, and lacerations. We see crush injuries and compartment syndrome from people trapped under debris. Smoke inhalation and respiratory distress are common in fires. Heat-related illness, including heat exhaustion and heat stroke, occur during extreme heat events. And dehydration and electrolyte balances are widespread. In the early phase, from 3 days to 2 weeks, the pattern shifts. We start seeing wound infections from injuries that occurred during the disaster. Waterborne illnesses emerge from contaminated water. Respiratory infections spread in crowded shelters. Chronic conditions that were stable before the disasters start to exacerbate. And we see mental health crisis as the reality of the situation sets in. In the late phase, 2 weeks and beyond, we see chronic disease complications from interrupted care. Mental health disorders like PTSD and depression are more apparent. Communicable disease outbreaks can occur in displaced populations. And malnutrition may develop in displaced populations with limited food access. And the long-term effects of toxic exposure begin to emerge. Understanding these patterns helps you to anticipate the health needs that will arise and help you to prepare accordingly. Disasters don't just affect individual health, they have public health consequences that affect the entire community. Let's talk about infectious disease risk. When sanitation and water systems are disrupted, we have increased risk of waterborne diseases. Crowded evacuation shelters facilitate the spread of respiratory infections and communicable disease, which is why vaccination is important. Get vaccinated. Vector-borne diseases increase when flooding creates breeding grounds for mosquitoes. And foodborne illness occurs when power outages compromise food safety. Environmental health hazards multiply during disasters. Air quality degrades from smoke, dust, and chemical releases. Water becomes contaminated with sewage and chemicals and radiation. Soil contamination affects food safety and can persist for years. And hazardous waste exposure occurs during cleanup efforts when people are trying to salvage belongings and rebuild. We also have to consider the social determinants of health. Disasters create housing instability and homelessness. Food insecurity increases when stores are closed or people have lost income. Loss of employment and income affects people's ability to meet basic needs. Educational disruption for children can have long-term impacts on their development. And social isolation and community fragmentation occurs when neighborhoods are destroyed and people are displaced. As nurses, we need to think beyond the individual patient to the community and the population level. Public health nursing skills are essential in disaster response. Let's get practical about nursing assessment in disasters. First, you need to take an environmental health screen. Ask about exposure to smoke, chemicals, radiation, and contaminated water. Find out the duration and intensity of exposure. Brief exposure is different from prolonged exposure. Ask whether they used any protective equipment. Assess their living conditions. What type of housing do they have? Do they have air conditioning? Do they have air filtration? And ask about their occupation and whether they work outdoors. For physical assessment, priorities start with vital signs, temperature, heart rate, respiratory rate, and blood pressure. Assess hydration status and skin turgor. Do a thorough respiratory assessment, including breath sounds and oxygen saturation. Cardiovascular assessment should include asking about chest pain and checking for edema. Skin assessment looks for burns, rashes, and wounds. And neurological status is critical. Altered mental status or confusion can indicate heat stroke or dehydration and other serious conditions. Don't forget psychological assessment. Screen for mental health issues such as anxiety, depression, PTSD symptoms. Assess coping mechanisms and support systems. Who do they have to help them? Evaluate access to resources like food, water, shelter, and medication. Assess safety concerns and ongoing threats. Are they safe where they are now? This comprehensive assessment gives you the information you need to provide appropriate care and connect people to resources. Now let's talk about nursing interventions across the disaster cycle. In the preparedness phase, nurses participate in community disaster planning. You might serve on a planning committee or help develop emergency protocols. Conduct vulnerability assessments to identify who in your community is most at risk. Educate patients about emergency kits, evacuation plans, and how to prepare for disasters. And train in climate-informed nursing practices. Understand how climate change is affecting health in your region. In the response phase, nurses provide emergency triage and critical care. You might be managing surge capacity in healthcare facilities, making difficult decisions about resource allocation. You'll be treating heat-related illness, respiratory distress, and trauma. You need to address both physical and psychological needs. People are scared and traumatized. Coordinate with emergency management. Nurses are part of Emergency Support Function 8, which is public health and medical services, and ensure continuity of care for chronic conditions, even in the chaos of disaster response. In the recovery phase, provide ongoing care for disaster-related health issues. Screen for and treat mental health impacts. This is when PTSD and depression often become apparent. Support community building efforts. Advocate for equitable recovery resources. Make sure vulnerable populations aren't left behind. And document lessons learned for future preparedness. What worked, what didn't, and how can we do better next time? Patient education is a critical nursing intervention. Let me give you some specific teaching points from different disaster types. For heat safety, education, teach patients to stay hydrated with water, not caffeine or alcohol, which can worsen dehydration. Teach them to recognize warning signs of heat illness. dizziness, nausea, confusion, rapid heartbeat. Encourage them to use cooling centers during extreme heat. Many communities open these during heat waves. Remind them to check on vulnerable neighbors, especially elderly people living alone, and emphasize never leaving children or pets in vehicles, even for a few moments. For wildfire smoke protection, teach patients to monitor air quality reports. There are apps and websites that provide this information. Not to mention, if you actually still watch local news, they almost always report about it on the weather. Teach proper use of N95 masks during smoke events. Surgical masks don't filter the fine particles in smoke. Advise staying indoors with air filtration when possible. And tell them to close windows and doors, even if it gets hot inside. And remember, limiting outside physical activity when air quality is poor is essential. For communities near contamination sites, radiation safety education is important. Teach patients to avoid contaminated water sources, advise not consuming livestock from contaminated areas, encourage participation in health monitoring programs if they're available, and tell them to seek medical evaluation for unexplained symptoms. This kind of anticipatory guidance can literally save lives. I want to talk about advocacy and policy because this is a fundamental part of nursing. Sometimes it gets overlooked. In the American Nurses Association mandates that nurses practice in a manner that advances environmental health. In the face of climate change and environmental disasters, this is not optional. It is fundamental to our role. What does advocacy look like in practice? Advocate for public cooling centers in communities, especially in low-income neighborhoods. Support policies that protect outdoor workers from heat exposure. This might include mandatory breaks, access to shade and water, and limit on work during extreme heat. Champion green space in low-income neighborhoods. Trees and parks reduce the heat island effect and provide places for people to cool down. Push for cleanup of contaminated sites. Communities have been waiting for decades for remediation. And then demand equitable disaster recovery resources. Too often, wealthy areas recover quickly while poor areas are left behind. And support climate change mitigation policies that address the root cause of increasing disaster. Policy alignment might include supporting Radiation Exposure Compensation Act for downwinders, advocating for EPA Superfund designation for contaminated sites, supporting occupational safety standards for heat exposure, and promoting healthcare system resilience planning. Here's what I want you to remember. Nurses are uniquely positioned at the intersection of clinical care and community health to address the inequities that make disasters deadly. You have to stay involved. You see the impacts on individual patients, and you understand the community and policy context. Use that position to advocate for change. Now, let's zoom out and look at the bigger picture through the lens of planetary health. Planetary health is a solutions-oriented transdisciplinary field that focuses on analyzing and addressing the impact of human disruptions on the Earth's natural and human health systems. The key principles of planetary health include interconnection within nature, human health, being fundamental, and that it depends on a healthy ecosystem. When we destroy ecosystems, we harm human health. Equity and social justice is another principle. Environmental burdens fall disproportionately on vulnerable populations, as we've discussed. Systems thinking recognizes that complex problems require holistic solutions. We can't just treat systems we have to address root causes. And movement building emphasizes that we need collective action for systems change. Here's a sobering fact: 7 of 9 planetary boundaries have been exceeded. These boundaries represent safe operating spaces for humanity. We've crossed the boundaries for climate change, biodiversity loss, biochemical cycles, and others. We are in uncharted territory. There is a saying: the hummingbird's struggle is air struggle. When climate change disrupts ecosystems and causes phenological mismatch where the plant blooms before the pollinators arrive, it affects the entire food web, including human food systems. Everything is connected. As nurses, we need to understand these connections and help patients and communities understand them too. This brings us to nursing education imperatives. What do you as nursing students need? You need to learn to practice effectively in a climate changed world. You need environmental health assessment skills, how to take environmental health histories and recognize environmental health hazards. You need disaster nursing competencies across all phases of the disaster cycle. You need to understand social determinants of health and human equity, how social, economic, and environmental factors affect health outcomes. You need to understand the connection between climate change and health. This isn't just an environmental issue, it's a health issue. You need to learn about community resilience and adaptation strategies, how communities can prepare for and adapt to climate change, and you need skills in advocacy and policy engagement, how to influence the system and policies that affect health. This content needs to be integrated across the curriculum. In medical surgical nursing, learn about chronic disease exacerbation during disasters. In community health, learn about population-level disaster preparedness. In mental health nursing, learn trauma-informed care and in post-disaster populations, or for post-disaster populations. In pharmacology, learn about medication management during disruptions. And in leadership, learn about coordinating disaster response. Here's my call to action for you. As future nurses or as current nurses, you will practice in a world increasingly shaped by climate change and environmental disasters. Your role is critical. You will be on the front lines of caring for affected populations. You will be advocates for vulnerable communities. You will be leaders in building resilient healthcare systems. Take this responsibility seriously and prepare yourselves well. Let's wrap up with the key takeaways from today's presentation. Number 1, climate change is real. It's not a hoax. It's not something somebody made up. The evidence is clear. It's not debatable. It does exist, and it is impacting how weather impacts us. For physical health impacts, remember heat-related illness, respiratory distress, and smoke radiation exposure, and chronic disease exacerbation. You need to know about this. Understand that injury patterns vary by disaster type and phase. For mental health consequences, remember that PTSD, depression, and anxiety are common after disasters and can be long-lasting. Community trauma affects entire populations, not just individuals. For healthcare system disruptions, understand the challenges of surge capacity, continuity of care, and resource allocation. Infrastructure damage can persist for years, affecting healthcare delivery long after the immediate disaster. For long-term health effects, remember that cancer, chronic respiratory disease, and cardiovascular disease can develop years after exposure. Intergenerational impacts occur in contaminated communities. After the recovery timeline extends years to decades, know that this is not a short-term issue. Finally, remember the nursing role: assessment, intervention, education, and advocacy across all phases of the disaster cycle. Environmental health is fundamental to nursing practice. It's not a specialty area, it's part of what every nurse needs to know. Thank you for your attention. If you have any questions, please reach out to me. You know when I have office hours. You have my contact information.